Adult coloring books, a popular trend or a serious tool for managing stress. A clinical trial found they significantly reduced anxiety in ER patients by an average of 3.7 points. In fact, patients were over 10 times more likely to color for an hour than to engage with a placebo. And the benefits are fast. Measurable stress reduction can happen in as little as 15 minutes. So how does this work? We'll break down the psychology, look inside your brain, and see what the data shows. The first reason is a mental state called flow, total absorption that quiets the noise of anxious thoughts. This state is a form of mindfulness, anchoring you in the present moment. Your focus shifts from what if to what color next. By occupying your brain, coloring effectively blocks rumination, the repetitive cycle of negative thinking. So we know it affects our thoughts, but what is happening inside our bodies? This is more than a distraction. It's a physiological event. The simple, repetitive motion of coloring helps activate your parasympathetic nervous system. This is your body's rest and digest mode. Studies confirm this by measuring the physical changes: decreased heart rates, slower breathing, and altered skin conductance. This physical calming has a direct effect on your brain's emotional centers. Specifically, it can soothe the part of your brain that acts as a fire alarm for stress. We're talking about the amygdala, your brain's fear center. During stress, it becomes hyperactive. So how can coloring quiet it down? The answer lies in your frontal lobe. Coloring engages this thinking brain area with planning and problem solving, which helps regulate the amygdala's signals. By focusing on this structured, low-stakes task, you are effectively telling your amygdala, I am safe, I am in control. Order directly counters the feeling of chaos. This brain-occupying effect is so powerful, it can even reduce the perception of physical pain by diverting your brain's limited attention. We've seen the theory, but does this hold up in high-stress, real-world scenarios? The research shows it does, even for those with diagnosed conditions. Studies have shown significant benefits for people in extremely stressful situations, including caregivers of cancer patients who find it a valuable coping tool. It's not just for situational stress. For patients with generalized anxiety disorder, adding coloring to their treatment led to better outcomes than therapy alone. This reinforces what we saw in the emergency room. Coloring is a potent intervention tool, whether the stress is acute or chronic. But does any kind of coloring work? Research suggests that structure makes a significant difference. Coloring complex geometric patterns, like mandalas, is often more effective at reducing anxiety than free-form drawing because the structure induces a meditative state. And in the digital age, the medium matters too. One study found digital mandala coloring was even more effective than paper. Digital versions produced a greater reduction in heart rate and skin conductance, suggesting the focused digital environment amplifies the calming effects. A key distinction is that coloring is not a replacement for clinical art therapy. It is a self-guided tool, while art therapy is a deep process with a professional. So let's connect the dots. How do a simple pattern, your brain's fear center, and your heart rate all link together? Remember how structured patterns like mandalas are more effective? Their complexity is perfect for inducing the flow state we discussed earlier. This deep flow is the key to calming your amygdala. By fully engaging your frontal lobe on the pattern, you are actively regulating your brain's fear center. And when your amygdala calms down, your parasympathetic nervous system takes over. That's when we see the measurable drop in heart rate, the physical proof of a mind at ease. So, coloring isn't just a nostalgic hobby. It's a low-cost, accessible technology for self-regulating your own nervous system. It works by creating mindful flow, which occupies the brain's executive functions, which in turn calms the brain's fear center and activates the body's relaxation response. And that is why something as simple as a coloring book can make a measurable difference in the high-stress environment of an ER. Do adult coloring books really reduce stress? Clinically inspired research gives a clear answer: yes, through a powerful combination of psychological in physiological mechanics. Whether on paper or a screen, it's a powerful reminder that sometimes the most effective tools for managing our mental state are the simplest ones.